We all want to stay healthy, especially as we enter flu and cold season. Today's guest owns and operates a growing health clinic in Lethbridge. Dr. Sean Hantke, CEO and Clinical Director of East Meets West Health Center, also known as 608 Health. He joins me via Skype from his office here in Lethbridge. Dr. Hantke, welcome to Bridge City News. It's so great to have you on.
Thank you.
First of all, Dr. Hantke, tell us about your plans to open up your brand new building downtown called 608 Health. So with the new location, will this bring some changes for your clinic as to how you provide healthcare services for your patients?
Most definitely. Our model will still remain the same. We're just adding, I guess, more conventional mainstream healthcare modalities to the team by adding basic family health docs, as well as specialists, a full dental clinic, including hygiene, pharmacy, as well as we'll have childcare on site for our patients, eliminate one of the barriers to access some of the services.
Now, are you excited to be a part of the city's efforts to revitalize the downtown core?
I am. The city has actually been really good to work with throughout this project. Obviously, a project of this magnitude doesn't happen overnight. It's been a few years of working with the city, trying to find a appropriate location. We always wanted to be in the center of the city for ease of accessibility for all our patients, and that the city was really good to work with. And we hope that we're the catalyst for that revitalization of the downtown.
What are some of the positive things you're hearing from the downtown community?
The downtown community is really excited to have a service like ours, a clinic like ours. The building that we're building right now is 18,000 square feet, so it was a major renovation that we've done. It was an existing single-story building that we've put a second story on, really modernized that building. It was built originally in the 1970s, so we've put a little bit of a modern flair on that downtown corner.
Oh, sounds lovely. I can't wait to see it when it's done. And speaking of which, it sounds like this has been a long process. It's been in the works for a while, hasn't it?
Yeah, it has. You know, finding the appropriate location as well as the staffing and like-minded individuals, healthcare professionals that really understand our model, because our model is very unique and different than most.
Yeah, and so you're currently on the north side location and you're going to be moving into downtown, so you're not quite there yet. When are you actually opening your doors downtown?
We're hoping for February, end of February, early March to actually start seeing our patients within there. There's a lot that still needs to happen, but we're very optimistic that we can get it done by end of February.
And by the way, I'm guessing that you have likely gotten a few questions about the new company name and what it means. So what does 608 Health stand for?
Well, we went through a really extensive rebrand process. I've owned East Meets West for 16 years, so that name was created when I was just a standalone acupuncture clinic. So the name was really fitting. But as we've grown and expanded the healthcare modalities included, the name we wanted to rebrand. So we went through an extensive process. We came up with 608. The simple version of it is 608 is the address of the building. However, when you look at 608, our vision for our brand is limitless health, endless possibility. So if you look at 608, it kind of looks like go, and then if you turn the 8 on its side, it's infinity. So go infinity. It really follows the vision of our brand.
Okay, and then like you said, it's your address too, right?
Correct. 608 Fifth Ave South.
That's kind of cool. Okay, yeah. So what's the overall vision of your health clinic? And can you share maybe a bit of your background story of coming to this point?
So my background is I'm a doctor of Chinese medicine. I went to school in Vancouver, did some internship work in China, worked there for 6 months. I guess that was my first taste of really seeing Western medicine, Chinese medicine working together instead of opposing one another. The treatment plans that were laid out gave patients options as to which direction to go, as well as they communicated amongst the two modalities, and the results were amazing. So originally for about 4 or 5 years, I was just acupuncture. Then we started to bring on some massage, then chiropractic, physio, those types of modalities started to follow. Our model's a little bit unique in the sense that there are other clinics out there that exist that are a building that house multiple businesses. Our clinic is not like that. Our clinic, everyone is an employee, and we all really work together to find the best solution for our patients. Not every patient is the same. Not every treatment plan is the same for each person. People respond differently to different services. So it's a combination, the collaboration that gives the best results.
Now, you mentioned massage and chiropractic, but your clinic has so many other different types of treatments. Can you tell us what's all available for patients?
Yeah, so we have acupuncture, massage, chiropractic, as mentioned, physiotherapy, naturopathic medicine, medical aesthetics, shockwave therapy, speech language pathology, and then within the future will be sports psychology, regular family GPs, specialty GPs, two gastroenterologists in town, which we're really fortunate to have with us, as well as a full pharmacy, full dental. We currently own a dental clinic now, just offering independent hygiene services called 608 Dental Hygiene that we've been operating for about 2 years now, which will then move over into the new space with us as well.
Yeah, and now it's not usual to see dental also included in, like a medical clinic. So how did that come about?
On the dental side, I mean, dental is a very important part of our overall health. Uh, like you said, it isn't seen often where it's integrated in a medical type of a clinic, but we felt that it fit really well within our model. Um, what we put in our mouth is the first step of our health, and that's why the dental side of it is very important.
Well, that's a really good point. So, alternative health is becoming more widely accepted in today's society. So, what would you say to someone who's considering something like acupuncture or naturopathic medicine, for example? And what would you describe as the overall benefits of these treatments?
Um, Most of the allied health modalities, such as acupuncture and naturopathic medicine, we look at things from the root of the problem rather than just treating the branch. Why are these symptoms happening? And it is a collaborative effort. I truly believe that oftentimes you need multiple modalities working together to find the solution. Um, Sometimes you can get really good results with just doing one thing, but from our experience, what we've seen is when we can attack something from multiple levels, multiple disciplines, we're going to get the best results. We're treating the body as a whole rather than dissecting each individual symptom and treating that symptom individually.
Interesting. Okay, so now with the onset of winter, it seems that various flus and coughs seem to increase, like in general, right? So, what kinds of things do you recommend for patients to stay healthy during the flu season?
Really just taking care of yourself, get good rest, and ultimately listening to your body. When your body says it's had enough, you need to stop, listen to your body. Your body's giving you these signals and cues because it's telling you that you need to slow down or you need some help. Otherwise, you're going to get sick. So focusing on yourself rather than just waiting for the symptoms to happen, being proactive instead of reactive in a case like this is super important.
Well, that's awesome. I wish you all the best of luck with your move to your new downtown location. Thanks so much, Dr. Hantke. Sean Hantke is the clinical director of East Meets West Health Center, also known as 608 Health, to come to their new downtown location beginning early next year. Thanks for being on the show.
Thank you very much for having me.